Welcome to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. In this, the second section of Module 3, we will explore how to select an appropriate analysis for some of the most common study designs. In general, choosing an analysis depends on the measurement scale of your variables and on your study design. In the realm of quantitative analysis, for a continuous variable, a single sample t-test is used to determine whether a population average or mean is different from some hypothesized value. An independent samples t-test is used to determine whether two independent population means are equal. A paired t-test is used to determine whether there is no difference between paired values from two data sets. Analysis of variance is used to determine whether more than two population means differ. And linear regression is used to predict values for one variable given values of some other variable or variables. A chi-square test is used to examine the association between two categorical variables. Logistic regression is used to predict a binary or yes-no outcome as a function of one or more predictor variables. For an ordinal variable, a rank sum test is a non-parametric method used to determine whether two different samples come from the same population. A signed rank test is another non-parametric method used for matched samples to determine whether their population mean ranks differ. Note that non-parametric methods are not based on assumptions about the distribution of the data, whereas the more common parametric methods assume that data are normally distributed, appearing as a bell-shaped curve. This diagram provides guidelines for choosing a quantitative or statistical analysis based on your study design. Options for analyzing single-group data include a single sample t-test, paired t-test, and signed rank test. Options for comparing two groups include an independent samples t-test, chi-square test, and rank sum test. Options for comparing more than two groups include analysis of variance, a chi-square test, and the Kruskal-Wallis method. Options for predicting outcomes include linear, logistic, and count regression. In qualitative research, observation is well established, but when should you use it? Observation can occur one-on-one or in a group and may involve interactions between family members, physicians, nurses, and children. Scenarios include verbal and nonverbal interaction with others, in the home, at school, and at the bedside. Although straightforward, one disadvantage of observation is that the individual is aware of your presence and may alter his or her typical behavior. Interviews require questions that are not leading. Instead of, "Did you feel upset today?" you could use, "Describe to me how you felt today." Interview location also matters, as does the interviewer's tone, voice, and eye contact. Word choice is important, and the sequence of questions is key. Rounding out common tools in qualitative research are field notes, which offer the researcher a place to collect personal feelings about the data collection to help identify bias and other potential issues. This diagram provides guidelines for choosing a qualitative analysis. An option for analyzing observations is to record a given sequence of events. An option for analyzing transcribed interviews is to develop an underlying text or narrative. An option for analyzing field notes is to record your personal impressions, for example in a journal. Such options will often be based on a broader analysis of categories or themes within your data. Now we will revisit our prior clinical examples. In Module 2, our first clinical question focused on the influence of two variables, sodium intake and physical activity, and how a decrease in one and an increase in the other could lead to changes in patient blood pressure. We will use a prospective study design, and our outcomes will include average daily blood pressure and physical stamina. Our metrics will include average systolic and diastolic blood pressure values and average stamina in minutes. This diagram illustrates our analytic approach. We're working with a continuous variable and comparing two groups. Our descriptive analysis will focus on averages, ranges, and standard deviations, or measures of variability. Our inferential analysis, which uses statistical methods to draw inferences about the broader study population, will focus on independent samples t-tests to compare groups' means and perhaps linear regression to predict outcomes based on group membership and other factors like patients' age, sex, and body mass index. In Module 2, our second clinical question was whether varying exercise types for patients could lead to short and long-term changes in pulmonary function. We will use a case control study design, and our outcomes will include average FEV1 values and average SpO2 values. Our metrics will include average FEV1 values as a percentage of normal capacity and average SpO2 values as a percentage of oxygen saturation. This diagram illustrates our analytic approach. We are working with a categorical variable and comparing two groups. Our descriptive analysis will focus on average percentages and ranges of percentages. Our inferential analysis will focus on chi-square tests to compare group percentages and perhaps logistic regression to predict whether FEV1 and SpO2 values fall within a healthier versus less healthy category based on group membership and other factors like patients' age, sex, and body mass index. In Module 2, our third clinical question focused on caregivers' experiences and collaborations when treating patients with lymphoma. We will use an ethnographic approach with exploratory open-ended interviews, digitally recorded and later transcribed. We will recruit clinical staff in an outpatient setting in community-based primary care clinics and nurses working with patients diagnosed with lymphoma. The main inclusion criteria will be adults between the age of 24 to 64 who care for patients with lymphoma in the hospital and at home. The interview guide will be designed by healthcare professionals, scholars, and caregivers. We will then read all transcriptions, develop themes, and produce final categories. All interpretive analysis will be reviewed by scholars to ensure validity. In using an interpretive analysis, we anticipate that both family caregivers and healthcare professionals will report making efforts to discuss issues together, sharing concerns, and collaborating in managing patients with lymphoma. This would demonstrate the importance of family caregivers' participation in clinic visits and would suggest that caregivers should be a valued part of the healthcare team. Such results would also suggest that coordination of care should be deliberate and a priority for this patient population. In the next module, we'll discuss how to effectively use tables and graphs in presenting study results. Now I'll ask you to reflect on what you've learned. What is an appropriate analysis for a categorical variable? A chi-square test is appropriate for analyzing categorical data, that is, to examine the relationship between two categorical variables. What is an appropriate analysis for a continuous variable? Analysis of variance is appropriate for analyzing continuous data, that is, to determine whether more than two population means differ. True or false, linear regression models are used to predict outcomes. The answer is true. Linear regression models use a single variable or a combination of variables to predict a given outcome. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni, in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations, you have completed Module 3.